A plane carrying the first batch of Mpox vaccines landed in the Democratic Republic of Congo on Thursday. It's the epicenter of an outbreak that prompted the UN to declare a global public health emergency. A European Union official said the first delivery consists of 99,000 doses manufactured by Bavarian Nordic. They were donated by the EU. He said another delivery on Saturday will bring that total to 200,000 doses, with the aim of getting 566,000 of them to wherever needs are greatest in the region. A lack of Mpox vaccines in Africa has hampered efforts to stop the sometimes deadly disease. The delivery in Congo should start to address a huge inequity that left African countries with no access to the 2 shots used in a 2022 outbreak, while they were widely available in Europe and the US. Congolese Health Minister Samuel Roger Kamba Malamba says authorities will start planning who will get the vaccine and where, with the aim of prioritizing what he called hotspots. Congo has said it will launch its vaccination campaign on October 8th. That will give it time to carry out an awareness-raising campaign to overcome mistrust in some communities.
Lying on thin mattresses on damp earth, this is an overcrowded makeshift Mpox isolation ward in East Democratic Republic of Congo. The country is the epicenter of the global public health emergency declared by the World Health Organization last month. Overstretched hospital workers grapple with drug shortages and lack of space to accommodate the influx of patients. In Kavumu, 900 symptomatic patients, like Sifa Mwakasisi, have been taken in over the past 3 months.
They should give us medicine and put us in good conditions instead of just locking us in this cage as if we're not human, telling us no one should come near us.
The head of the Congo's Mpox response team acknowledged that parts of the vast country lacked medicine. He added that dispatching donations, including 115 tons of medicine from the World Bank, was a priority. Relatives, who usually provide the bulk of meals in underfunded public facilities, were banned from visiting the Mpox ward to avoid contamination. Basic treatment is also a challenge. Here's Kavumu Hospital's medical director, Musole Mulamba Muva.
We have many challenges. The first challenge concerns the supply of medicine, because we run out of medicine every day, because the stocks given to us by partners often run out without being able to renew. We have to wait for more medicine to arrive, and so we always experience shortages, medicine shortages. And that's a big challenge we have in managing this disease.
Mpox causes flu-like symptoms and pus-filled lesions and, while usually mild, it can kill. Children, pregnant women and people with weakened immune systems are at a higher risk of complications. Vaccines are set to arrive within days to fight the new strain of the virus, while Congo's president has allowed a first $10 million disbursement to fight the outbreak. Over 19,000 suspected cases of Mpox have been reported since the start of the year in Congo, according to the health ministry. Of those, 5,000 were confirmed and 655 were fatal.
Scientists studying the new Mpox strain that has spread out of the Democratic Republic of Congo say the virus is changing faster than expected. And it's often happening in areas where experts do not have the funding or equipment to properly track the virus. Reuters spoke to half a dozen scientists in Africa, Europe, and the US who outlined a number of unknowns.
We are still working blindly in Africa.
Dr. Dimye Agoina is an infectious diseases expert in Nigeria who chairs the World Health Organization's Mpox Emergency Committee.
We don't have the required knowledge about Mpox, natural history, transmission dynamics, risk factors of Mpox. You need to understand your disease for you to develop or design preventive strategies against such a disease.
Mpox, formerly known as monkeypox, is a viral infection that causes pus-filled lesions and flu-like symptoms. Cases are usually mild, but they can be deadly. The virus has been around in Africa for decades, but an international surge in 2022 prompted the WHO to declare a global health emergency for about 10 months. Now there's a new strain and a new WHO emergency declaration.
The situation constitutes a public health emergency of international concern.
The UN agency says Congo has had more than 600 Mpox deaths this year, and more than 18,000 suspected cases of the new strain and its earlier iteration. There have been cases in 4 other African countries, as well as in Sweden and Thailand among people who had traveled to Africa. Scientists say a response is complicated by several outbreaks happening at once. In some cases, the spread has been linked to human contact with infected animals. It can also spread through close contact with an infected person. Mutated versions of the virus can essentially be considered a sexually transmitted disease, says South African epidemiologist Dr. Salim Abdul Karim, who chairs the Africa CDC's Mpox Advisory Committee.
It's case identification, contact tracing, and vaccinating and monitoring and treating, giving prophylaxis to contacts. So this is not rocket science. We do this for other infections. And so we can do it for Mpox.
An Africa CDC senior official said on Wednesday that the continent has secured less than 10% of an estimated $245 million needed to fight the surging outbreak. And there's no timeline yet on when hundreds of thousands of vaccine doses might reach the DRC.